Afternoon, folks. Some of you are still connecting by audio. It's awesome to have you with us on a Friday afternoon, an unusual time for a chamber chat. But when the Greater Kitchener-Waterloo Chamber and the Cambridge Chamber get together, you absolutely never know when it's going to take place. And it's taking place on Friday afternoon. So it's our pleasure to, on both chambers' behalf, the Greater Kitchener-Waterloo Chamber of Commerce and the Cambridge Chamber of Commerce, to be bringing this little briefing of a little bit of information for the upcoming implementation of the provincial government's Ontario vaccine certification or verification program. We were provided a briefing with ministry officials, I believe the morning before it was announced. We had the opportunity, Chambers of Commerce are really a partner with all governments to communicate information. And so they reach out to us in advance so that we can start to compile information, get questions answered. But oddly enough, there were a lot of questions from Chambers of Commerce across the province. Not all of them were answered on that briefing, but we did get a bundle of answers back afterwards that we hope will answer some of your questions as we go. So thanks very much for those of you who are members of the Greater Kitchener-Waterloo Chamber of Commerce. Welcome to Cambridge Chamber of Commerce Chamber Chat, and we appreciate you attending today, of course, and hopefully we'll get to as many of your questions. You can post your questions in Chamber Chat, or in chat at the bottom. My staff will monitor those who are on and try and refer me to a particular answer that's in our briefing packages that we received, and hopefully we'll get to as many of them as we can. But let's start first of all so that I can give you some highlights of our briefing that took place a few days ago. So as you all know, there is a mandate or
why don't I have any sound?
Legislation from on September the 22nd. There are a number of places of business and public entities that will require to screen and check for vaccination status of every patron coming into the building or into their business. And for those who do not qualify and cannot provide that evidence, they will be not permitted inside. But let's have a look at some of those. So some of those that are maybe pretty obvious are restaurants, of course, bars and other establishments, but exclude the outdoor patio areas of those particular businesses. And I know what you're probably thinking now. Well, what if they have to come in and pay, et cetera? We'll get to that in a moment. Indoor areas of concert venues and theaters and cinemas, of course, will require all participants to be vaccinated. Indoor and outdoor areas of food or drink establishments with dance facilities, example, nightclubs and other clubs that might have that, obviously excluding delivery and takeout. Indoor areas of horse racing tracks and car racing tracks. I don't think we have too much of that going on here, but if we do, you are also in that situation. Indoor areas of commercial film and television productions with studio audiences, indoor areas of water parks. That's indoor areas of water parks. Indoor areas where spectators watch sporting events. That would mean every arena, of course, and every indoor swimming pool. Indoor areas of casinos, bingo halls, and other gaming establishments. Indoor areas of facilities for sports and rec facilities such as gyms and yoga clubs and et cetera, et cetera. Also, all indoor areas of meeting and event spaces, banquet halls, and conference and convention centers as well. And I don't think we have the last one, the strip clubs and bathhouses and sex clubs, but they probably should always be checked for vaccinations in any event. There are some exemptions, of course, for proof of vaccination that we don't need to worry about. And so if you have a patron on your patio that needs to use the washroom, they're not required to be fully vaccinated to go in. However, what is important to remember here is the provisions for contact tracing and screening that you normally do will still continue. So even those individuals coming in to use your washroom will have to be as well screened, but they should be screened in any event, even if they're on your outdoor patio. If they got to pay for an order, same thing. They don't need to be fully vaccinated. If they have to access an outdoor patio area that can only be accessed through the indoor, of course, they can go in through. They don't need to jump a fence or climb a wall or anything like that. To place or pick up an order, and as in the case of placing bets and picking up winnings at a horse track, of course, they are the same. Or to purchase any admission tickets that might be at a venue. Or to make a retail purchase. So some of you who might have indoor restaurant facilities, patrons coming in to make a retail purchase, if you have a little store at the front, they will not be required to be fully vaccinated. And anything necessary for the purposes of health and safety. However, we couldn't really nail down or identify what that actually means. Children under 12 are exempt, of course, because they can't be fully vaccinated. And patrons under 18 who are entering an indoor premises or facility used for sports or recreational solely for the purpose of the activity and participating in organized sport in accordance with the Ministry of Health. So an example would be if a 17-year-old goes in to watch his little brother or little sister perform, play hockey or whatever it happens to be, they must be fully vaccinated. It is only the participants that aren't required to be fully vaccinated. Weddings and funerals, you don't have to show proof of vaccination if you're attending a wedding or a funeral service, rite, or ceremony, and you are not attending the associated social gathering, for example, receptions. So the social gathering associated with a funeral service, rite, ceremony, that is being held in a business licensed under the Funeral, Burial, or Ceremonial or Cremation Services Act of 2022. You need to understand that as well. And that's very confusing because in the actual legislation, there is some association with people attending social functions for weddings and funerals can undergo a rapid screen, but we're trying to get identification. Does that allow them to go to the reception if they rapid screen prior to entry? We have not got that answer as of yet. Patrons with written documentation by a physician or nurse practitioner stating they are exempt for a medical reason from being fully vaccinated. You don't have to have the reason why they're exempt, but you have to have a visual contact of the letter signed by a physician that has a physician's name and address on it as well. And the same applies with confirming that the individual being spoken about in the letter is actually the individual you're talking to as well, or admitting. So we are fighting desperately hard with the provincial government to get the digital format of this proof of vaccination out as quickly as possible. We don't necessarily believe that it has to wait until October the 22nd. In fact, we feel that they can actually deliver it on day one, September 22nd, which we think, if we're going this route, in order to alleviate some of the pressure on business, getting the digital format out is essential and should be immediately undertaken. And in fact, if it could be released on September the 22nd, that would be the ideal situation, because here is what you have to go through. So you need to get the ministry's certified vaccination receipt. They have to provide that, as well as they have to provide identification as well. It doesn't have to be necessarily photo identification. It just needs to be identification that has the same name and the same date of birth, obviously, as the individual. And I think they're accepting, a lot of things. Most people are really going to use their driver's license in all probability for most cases. But here's what you have to do. You have to make sure that that matches with the individual who has provided you with this receipt from the Ministry of Health. And there are 4 key areas. Obviously, you have to confirm that it's a Ministry of Health document and that it's an official COVID-19 vaccination receipt. You have to make sure that the name and the birth date of the individual match the identification that they give you. You also have to look at the very bottom, number 3, is ensuring that you have received 2 valid doses. Somebody brings you a receipt that says they have received 1 valid dose. Unfortunately, that is not proof of full vaccination. It has to actually say you have received 2 valid doses as well. And the last piece is the vaccination date of when, and that will be the vaccination date of the second vaccine. And it must be 2 weeks. The date that they come into the business has to be 2 weeks following, 14 days following that vaccination date. And this is where, from our perspective, the real challenge and real problem for businesses is going to be, because somebody in your business is going to have to, first of all, understand this on what they're looking for and the areas that they're looking for it, confirm it before the individual can be allowed entry. With the digital format, all of that nonsense will be taken away. It will just be a QR code that the individual will present. You will be given the ability to download an app that will validate that particular QR code, in which you can just have a staff member simply put their phone or the business's phone over top of the QR code, and it will simply give you an indication, positive or negative, whether they qualify. You'll still have to do obviously the checking, the identification, making sure that it is the individual that is coming in. That's, that you can't do it any other way, because people can, swap phones or whatever the case may be. So it has to be, you have to still find the identification of the individual. And so the key identifiers are certainly looking at the birth certificate. Birth certificates don't come with a photo on it, obviously. So that's an acceptable form of identification. Citizenship card, driver's license, government issue identification cards, such as a health card, Indian status card for Indigenous membership card, passport, and that's going to be important. I'm going to come back to that in a second. And then a permanent resident card as well are all acceptable forms of identification. The reason I'm going to come back to passports is that you can, there quite possibly could be individuals from out of the country coming into your place of business, and there's a number of requirements to ensure that you are following the rules. There are other vaccines that the Ontario government will accept as proof of fully vaccinated. And there is one concern that we brought up that we got a very quick answer to, that if the vaccine status letter or certificate that the individual presents is in a foreign language, it will be incumbent upon, if you can't provide a translation for that, it will be incumbent upon the individual to provide a translation for that in some manner, whether they get it transcribed in English or another language in which you or your staff can follow along with. It's really important. But some of the vaccines, and I'll just give you a quick list. Brian from my office gave me a quick list. I will certainly not get the right names for this, but some, like, there are even Sputnik V, Sputnik Light. Sounds more like beer to me, but apparently they are vaccines. CanSino Bio. A number of countries use that, I guess, in Europe. Covaxin is another one. Sinpharmin, Coronavac, and Sinovac are others. You're going to have to post these, and we can provide you all that information in the event that you do have foreign travelers as well. There are a number of things, individuals that you might be able to help with. Folks can go on to the web, actually, and you can download your passport or your vaccine certification form right off of the government website. You need to have a green health card, though, to do that, because those are the right numbers. And I've done that, and I'll give you an example. This is what you get. You get a form like that. You can see that it doesn't have to be this one, but it has, it has to be a government authorized form. You can also download this as a PDF onto your phone and have it and provide it to, or an individual can provide it in digital format as well as a PDF at this point. But that's kind of what it looks like. And if you basically see the information up here, of course, is saying it's the Ontario government, the date of the second vaccine, and then you have received 2 doses. So it's pretty easy to do once you do that, but people are going to come in with all kinds of different scribes of that, I'm quite certain, and it's going to cause undue confusion for workplaces and businesses, and that's why we hope that they come out with the digital version of it as soon as possible. Here are the big things. Businesses and organizations are responsible for ensuring that they meet the requirements to check for proof of vaccination and proof of identification from patrons. That's your responsibility. Patrons are required to ensure that the information provided to the business or organization to demonstrate proof of vaccination and proof of identification is accurate. If it's been forged or otherwise, and you can't identify that it's been forged, that's not your issue to deal with. And I know the Minister of Health said that if one of your staff is harassed or whatever, to phone 911. I think 911 is obviously reserved for emergencies. If it is an emergency, of course, dial 911, but otherwise, you're going to have to contact the police, and we all know what that's going to generate right away. But hopefully we run into very few of those. Non-compliance by individuals and businesses will, of course, result in charges, or could result in charges and fines under the Reopening Act of Ontario. And that's kind of it from the information perspective that we were given. However, that probably has generated a number of questions from you. And generated a number of questions from us, and we can start to go through some of those to give you some indication of what those were. So, Brian, where should I start, or are we at the bottom of any questions?
Yes, there's Vanessa Stevenson has a question.
There are also a list of variations of vaccines proven for other countries. Yes, and we'll be posting that as well, I believe, on our website, and probably have it on chambercheck.ca as well. so that we give you as much information as we possibly can. But we'll list the vaccines that are acceptable.
Greg, I also want,
Go
I
ahead.
also wanted to ask about provincial financial supports, because this has just created, I need one full-time and a part-time position. I do not have the people to do the work that we have right now. The stress is unbelievable. What is there going to be to help us through this? Because as you know, we've already suffered immensely and we just got kicked. This is really kicking us while we're down.
Nothing at this point. However, we are continuing that fight as well. And my suspicion is they'll have to come out with something. It's, it's not unlike every program. They come out and say, no, there's nothing, but once we can get through the channels, something's going to have to happen. They're going to have to provide. This is going to create, a costly, exercise for businesses. And if they want it to work good, which we all want it to work, this is what's going to drive our numbers down. This is what's going to take us through, the end of this, we hope. And hopefully we don't have to have it forever and ever and ever. We get to the other end quicker, but the
sad thing is, in the meantime, I have to stop cleaning rooms, so I can't sell rooms anymore so that I can manage this. I mean, it's ludicrous when you think about it. We are in a hole that we can't get out of.
And I think the biggest, the other big problem that you will have, of course, is you can accept, you can rent rooms out to people who are unvaccinated, but they can't go into any dining areas, and they can't go into any swimming areas and exercise rooms or anything like that unless they're double vaxxed, which causes, you have to have people all over the place checking vaccination status.
Yeah, it's tough. It's going to be tough. It's going to be tough for people that deal with a lot of visitors from all over the place too. Like you said, I'm going to get stuff from every country known to man to decipher it. It's going to be
well, and for a hotel, that's a bigger problem. It's a bigger problem for sure. And as you know, Vanessa, we are working diligently to try and get the whole, tourism and leisure funding out the door from the government that was promised back in January as well. And it's a struggle, but we will get there. The government is starting to listen. I don't think they understand really, what goes on out here in the real world. But we can tell them it's quite a bit different than their world. That's for sure.
Thank you. Keep doing that.
Brian reminds me as well, as on question 18 says, all versions of the receipt are acceptable as proof of vaccination. Now, I'm quite sure he doesn't mean that even the forged versions of the receipt are acceptable. I think he's talking about any version that you can have, whether you got it when you were at the pharmacy or vaccination spot, whatever that receipt was, or the one you download off of the internet as well. And I'm wondering if we can, Lisa, maybe you can post that link to where you can download your vaccine status, and maybe people would like to have that to pass around to their patrons as well. No, there is no exemption for religious reasons. It is medical exemptions. All they talked about were exemptions through medical for medical reasons, if it's a doctor or if it's a nurse practitioner. Oh, there was something you can have a look if you're having trouble hiring people. They have a bit of funding for training if you hire someone as well. So have a look at that as well. Ontario is no longer in the state of emergency. Is this mandate? Yes, they are. Well, they're not in a state of emergency, but the COVID-19 protocols that the government put out actually don't end until December 1st. And there is a provision there that will allow them to extend it to December 31st. And for those of you in the tourism and hospitality and the provincial government extended the temporary layoff provision until January 1st, 2022. So that was to expire, I believe, on the 25th of September, where anyone who was temporarily laid off back at the beginning of the pandemic 18 months ago would be officially permanently laid off, and you would have severances and all of that kind of stuff to settle up with them. That has now been extended to January the 1st, 2022. Is there something in print, Mark? No, not that says no religious exemptions. All I can tell you is there is something in print, and we can probably provide that as well about I think it was on my slides that I showed you about what the exemptions are, which were all medical. So there was nothing else added to that I'm aware of, nothing in print anyway. So when the question, Vanessa, for your purposes, was asked about will the supports be provided for businesses to implement these new requirements, they said they're launching a new app that they'll give you for free. And they'll provide communication and support along the way. So I guess in all fairness to them, they didn't say no, there's no funding. So they won't have to backwalk that one. Because they can just say, oh, and now we've got some funding, but they did say that those are the supports you're going to get for now. There will be more information. The question was here, is there a resource page for vaccine certificate for businesses to download, like signage and that kind of stuff from it? That is supposed to come out prior to September the 22nd, and I hope the province gets something there. I can guarantee you this: the minute that we have it, the minute following that, you will have access to it. So we'll be watching that as close as we possibly can to make sure that you get what you need to implement this. There were a couple of the only changes to the original announcement that Doug Ford gave to the list of businesses or organization where proof of vaccination is required were indoor areas of commercial film and television productions with studio audiences and indoor areas of water parks. Those were added businesses to the list. So the full list, I think, was on our questions, and we might be able to post that as well. It is, I believe, it is posted on the ministry's website. I don't know whether we have that website or not. Lisa, somewhere maybe in our files, we might have it to all of the businesses that are affected by this. And you can choose, if you are a business that does not fall within the criteria of having to do this, you can as well choose to do it if you want to, and participate in the program and utilize the digital formats that will be coming out as well. However, they also say that the ministry is also saying they're not preventing you from other businesses from developing a vaccination policy. However, the ministry is reluctant to make that legislation. So they're always nice in saying that at the very end, you may wish to consult a lawyer before doing that. So obviously they are protecting their behinds while not protecting your behinds. And we've been all over them to make sure that they can give you the ability to do that, and you will have sound legislation behind you to protect you legally going forward. The one big question I think that came out right away was, why do patrons at these specified businesses or organizations have to be vaccinated, but workers not? And we've been simply asking the government to give clear and concise answers, and I'll give you the back room answer. Because first of all, the government won't go out and embed into legislation that a business can go ahead and put in a mandatory vaccination policy and demand that their workers all be vaccinated. So as long as the government doesn't do that, they're hesitating on what they're going to make employees do. The other thing, though, was more importantly, it came from public health, the senior official, the provincial public health doctor, who said the risks are much, much lower for unvaccinated people that work in a workplace simply because they undergo mandatory screening for coming to work each and every day. And in a lot of cases, and we see it more and more every single day here, more workplaces are implementing in mandatory rapid antigen screening tests for their employees as well. And in fact, I think the legislation came out for daycares and schools that there's mandatory requirement to rapid screen if you're unvaccinated or fail to declare your vaccination status, which really a failure to declare your vaccination status is an admission of being unvaccinated. So that's those are important things. And I would encourage everybody here on this call, if you have unvaccinated individuals in your workplace and you're concerned about developing a vaccination policy, because I know how difficult each and every day it is for you to hire people, please go to chambercheck.ca and order your screening kits. And you can and will get support from the provincial government to have them test. They have two choices. They can rapid screen when they come into work, or and validate that they're COVID free, or they can get double vaccinated. So don't hesitate to do that. Chambercheck.ca. Again, they say, businesses are not only eligible to go ahead, they may choose to leverage provincial guidance and technology to support the implementation of a workplace vaccination policy. But then they always clarify things at the end by saying you may wish to consult your legal counsel before implementing it. So they're not at the stage yet where they're going to embed it and say, yeah, you can go ahead and do it if you want to do it. And I think that's another big challenge I know there's lots of small businesses that would like to do that, but are really reluctant to maybe get into a battle that they can't afford. So outdoor areas here, this is interesting. So what defines an outdoor area? So if there's an outdoor area covered by tents, canopies, retractable roofs, are they considered indoor or outdoor? The setting is considered to be outdoors if an outdoor area of the business is covered by a roof, canopy, tent, awning, or other element, and if at least two sides of the area are open to the outdoors and not blocked by any walls or other physical barriers, or it's equipped with a retractable roof and the roof is retracted, at least one full side of the outdoor area is open to the outdoors and is not blocked by any walls or other barriers. So they are defining the outdoor space in a very broad way, I think, and there are a number of businesses I know who have the ability to open up or close, and they have a 4-season room that they can make sure that the walls, they do have a couple of walls open. Are businesses and organizations able to keep or retain any information related to proof of vaccine? Nope, and you don't want it. So this is what's really, really interesting. How are we going to prove that individual is unvaccinated over there? The proof is in one of your staff saying, yeah, I checked them out and they're okay. You can't retain the information, can't do anything. Now, contact tracing and taking the number and all of that stuff is important, is still a part of the legislation. You still have to do that. So there will be documentation of the individual being on your premises, but it won't be your responsibility to validate the information, nor to retain it. I actually thought for places like gyms and places of membership like that, it probably, you know, it would be wise. They already got most of the information from the individual anyway. They got all the contact information and credit card information and all that kind of stuff. Why not retain the look, I'd rather somebody have my vaccination status information than my credit card information. So I think that's probably safer, but at this point, no, they're actually saying you cannot capture that information. You cannot retain that information as well. They don't need to bring, so we all got, if you got your vaccination, you got your first receipt says you've had 1 dose of whatever, and then you went and got your second one that says you had 2 of 2 doses. You don't need to bring, patrons don't need to bring both of them. They just need to bring the one that says you've had double vaccination, so 2 doses. So some people have said, you know, I'm not comfortable showing all my personal information on my receipt. I'm not quite sure there's nothing personal on here. You know, I guess unless you're, you know, no, there's nothing personal on here. It doesn't make, other than my name and the last 4 digits of my health card. But somebody asked if you could block stuff off on your receipt. No, you tamper with it, it's considered a tampered receipt and it can't be accepted. So you have to accept the receipt. If it looks like it's been doctored, it's unacceptable. Does a previous COVID infection or recent negative test allow people who are not fully vaccinated to be considered fully vaccinated? Nope. Doesn't matter whether you've had COVID or not. The science is not there to say that that's effective immunity. In fact, I know there's conflicting reports on this, and anybody can argue any scientist they want, but the most accredited ones are saying you might get 3 months, maybe 4 months out of immunity out of COVID, but you do not get the protection that vaccines will give you. So people who had COVID are encouraged to still go and get their vaccine. The out of country stuff, I think number 21, question number 21, we really need to, you know, especially for those in the tourism industry, because you're maybe more likely, I think of the hotels like Vanessa, probably more likely to have people from out of the country. I think we need to post that or make sure that they get the information out on how does someone prove they are fully vaccinated, if documents are from out of the province or out of the country. It's a long answer and I don't want to get into reading it, but there are ways for them to do that, and they should be traveling with their documentation in any event. Because part of the problem is there's an inability for anybody in Ontario to read someone else's QR code from some other country or province for that matter. I can tell you this, what the province of Ontario has told us is there is going to be a synchronization of QR codes in Canada. So whether it's Quebec or New Brunswick or Manitoba or Saskatchewan now and Alberta now and BC, they'll all be integrated into a single format to be able to, so they'll be able to be read by the Ontario app as well. And then the international too, there is a list of vaccines that are acceptable. We'll send those to you. I think the only problem is going to be is what language is that receipt going to be in? And if they come with a digital passport, we might not have the technology at this point to be able to deal with that. And unfortunately, unless you can get it translated, the document translated, there's not a whole lot you can do. You need to protect your business.
Greg, there's two questions before you continue.
Okay.
One was regarding laminating your slip. I believe that is allowed as long as it's readable.
Yep.
And Joe is asking if the QR code, if businesses will be expected to use a mobile device or if they'll be provided with a scanner.
You'll be expected. My assumption is, and I doubt the province is going to come out and give millions of scanners out. So I would say they're going to give you access to an app that'll be free, of course, and you may have to download it onto your own phone or get your staff to do it, whatever it happens to be. The antigen tests, our contract with Health Canada actually goes to March 22. So Michelle, our knowledge is we're going to have them until March of 2022. Yeah, you have a good weekend too, Joan. I think she's gone now, but that was nice to see her anyway. Yep, the lamination. Let's see. Diane Long says, I think her date of birth is private and confidential information. You put that on every single app that you download on the internet. So what does it matter? Doesn't really matter.
No, anytime you go into an establishment, they could ask you for ID anyways.
Exactly. Yeah, I know. I don't like to tell anybody my age either, but sorry, Donna, it's not personal.
I assume you get ID'd every time you still go into an establishment, right, Greg?
Oh, I do. Absolutely. There's no question. I get, yeah, all the time. I order a drink and they say, wait a minute, we need to, and I am so happy, Kevin, to give that driver's license over and say, look at that. I am over 19. Let me just keep going through these questions. Somebody let me know when, because I'm reading this stuff, and somebody let me know if there's another question that comes up. Those who carry medical exemptions need to show proof of COVID-19 test. No, they'll if they have a medical exemption, they have a medical exemption. They don't have to prove anything at that point. So the question here was, is it going to be the business or organization's responsibility to for ensuring the reason for medical exemption meets the requirements? That's not going to be the case. However, they do get pretty specific here and want to make sure that you have the name of the person is on the document and it matches their identification, and that the physician or registered nurse's information, including their contact information, their logo or letterhead, and a statement that there is a medical reason. So this kind of goes back to Mark's question about religious. It actually has to say a statement that there is a medical reason for the exemption. So it's not saying it could be a medical or religious reason. It says it's got to state that it has a medical reason for the exemption. Let's see here. Oh, this was interesting too. Does proof of identity for ages 12 to 17 need to provide identification, as they may not have identification. Student cards are eligible to be used as well. However, it is interesting, and I think that if the patron is under 18 years of age and is entering an indoor premises of a facility used for sports and recreational purposes, they don't need to worry about it because they don't even have to show proof of vaccination at that point. However, as a business, you have to obviously, there's going to be a situation where if you're a bar, you can't let anybody in that's under 19 anyway. So you got to have some provision, or people got to prove age anyway. And it says here, business organizations should establish a process to ensure compliance with this requirement, including processes to ensure compliance with this requirement when a business or organization is uncertain whether a person is under 12 or not. So I think to some degree, they're trying to put the onus on you, the business, to ensure that you're not letting in a 14-year-old because they can be vaccinated, and if they're coming into your restaurant, they need to be fully vaxxed in order to come in and sit down and have a meal. So there will be something, but they said that the requirements of identification are flexible. And it's got to be, everybody has a birth certificate, I suppose. So parents are going to have to, if they want to go out with their kids, they're probably going to have to make sure that they bring their kids' birth certificates with them as well, to ensure that they can validate their age. So here's where it gets confusing. Do meetings and event spaces have to provide access to antigen testing for patrons as per the exemption for attending a social gathering associated with a wedding service, rite, or ceremony, or a social gathering associated with a funeral service in a meeting or event space between, I know why. They're allowing unvaccinated people to go into a wedding reception, for example, up until October the 12th, 2021. But in order to go in there, they will have to use a rapid antigen screen to validate their COVID-free. So within 48 hours of attending the wedding reception, these antigen tests would have to be privately purchased by the individual, or alternatively, if the business decides to purchase them. And it can, again, it has to be within 48 hours of the scheduled event.
So Greg, if they're using those, who's actually certifying the results?
I don't know. I guess you got to bring in the little thing and hope the date and time, maybe take a picture of it and have a timestamp on the photo. It doesn't say that, other than I would suggest, because we, are very familiar with rapid tests.
Yep.
They take 10 minutes so people can come in and they're going into the reception. Well, you stand outside for 10 minutes and do your rapid test, and then you can come in. As long as you show the little tab that says you're
stick with one line, not two.
That's correct. One line under the C, make sure.
Correct.
Can I use a PCR test instead of a rapid test when attending a social event? This is really interesting. It actually says where applicable and required, a patron must produce the results of an antigen administered test within the previous 48 hours. So no, a PCR test doesn't work. Let's see. I think they get into this a little bit, Kevin. Are operators permitted to delegate this to for who's supposed to check that? Well, Obviously, the business or the organization is going to have to check that. And so there will have to be something, a timestamp photo of the test. I don't know. I think it's kind of ridiculous to say people for 48 hours. An antigen test takes 10 minutes to give you the result. It should be done right on the premises, but we'll try and get clarity around that as soon as we possibly can.
Thanks.
Let's see. Is there anything else in the chat? No? Yeah. Once you get the QR code, yes, it will. Well, I don't think the QR code has the ability to update itself. So however, that being said, if you had, let's say a week ago, or 2 weeks ago, you got your first shot and you went in and you downloaded, it would say you only have one shot. And then, next week you go in for your second shot. Once you have your second shot, it's all attached to your health card. You have to go in and download you would have to go download another QR code, which would then update you to the second one.
Greg, above that question, Joe Hall had a question as well.
It actually said, no, Joe, it actually says a PCR test is not acceptable. It says an antigen test. That the PCR test is not an antigen test. The only antigen tests are rapid tests. I only got a few minutes. Does anybody else have another question while I'm going through some of these? Because we will put, Lisa, are you planning on putting these questions and answers up somewhere?
I can.
Okay.
Yeah, we can include all the information in a follow-up email just to keep it contained in one spot. Vanessa has also posted a question. I have posted a note that says your child under 12 may be asked for ID. Sometimes it's hard to tell their age. Is that actually okay?
Yeah, absolutely. Yeah, you have to, if somebody comes in and says, well, my child doesn't need to be fully vaccinated because they're under 12, well, then you have to give evidence of that. It's kind of no different than going anywhere where it says you got to be so old. You have to provide evidence of that. So yeah, unfortunately, people are going to have to, I'm glad we don't have any 12-year-olds around, but because Lisa would always remember to bring their ID, but I would never remember. I have a hard enough time remembering to bring my own identification, let alone my kids. So what was Joe's? Their restaurant staff are definitely going to be a punching, no question about it, Joe. And that's why we've asked, they're going to be a punching bag anyway. But we've asked, please don't implement this until you're ready with the digital version, because that'll lessen a little bit, because it'll, people can, it's just a QR code and, yay or nay. So we would rather have that rather than people have to dig into their wallet or their pocket for a piece of paper. And it's just, it's ludicrous. It's absolutely ludicrous. And we were on our radio show today. We were talking about how stupid it is. And believe me, we have let the province know how stupid it is as well. And the primary reason is they came out and said they want to do their own in-house version of it rather than use a third-party app. And there's good reason for that. You can't develop that app in 4 weeks. It's impossible. Like every single professional in that industry to provide the security you need can't do it in 4 weeks. So we know they've already done it. The app was built back in the spring before all of this even came, in anticipation of a tool that might be required down the road. And so that's already been built. It's sitting on a shelf in Queen's Park. And we're saying, well, rather than wait 4 weeks because you want to see what's going to happen, dust that baby off and get it out right now so that our businesses can implement the digital format immediately. I think it's absolutely ridiculous to not provide the digital code. Just ridiculous.
Agreed. And they've gone as far as develop that, but they didn't set anything as far as the funding to help any of us to actually pay staff to do this.
Well, they're no, exactly. But there's no question about it, Kevin. This is already, we actually have had it kind of confirmed, but it's all, don't tell anybody I told you kind of thing. But the app is built, it's done, it's finished, it's ready to go. They're simply going to say, okay, unlock it and send it out today. It is completely ready to go. And we're saying it's completely senseless to implement this. Look at it. It was September 22nd. And then the app is coming out October 22nd. Like, how do you figure out those dates? I can tell you, because we all know they don't do that. They come out and they say, we're going to implement it on September 22nd. And if they were really going to build it themselves, they're going to say, and as soon as we get the app developed, we'll be releasing the digital version out to all businesses across Ontario. No, they actually knew the date they were going to do it. The reason they knew the date they were going to do it is they already have it done. And they just want to see how long and how effective this is going to be. And I think it's absolutely crazy.
Greg, there's some more.
If unvaccinated guests are eating on the patio and the rain starts, they are welcome to go sit in their car, but they're not welcome to sit in your building. Write letters, Mark, to absolutely every MPP you can think of that is at least in the government, to Doug Ford. I can tell you that we actually have a staff member from the Ontario Chamber of Commerce that is at Queen's Park every single day and banging on doors and saying, this has got to be done. This has got to be done. Chambers from right across the province, we have universally and unanimously said, don't implement this until you've got the digital version, because we know they got it. So there's no sense in sitting back and saying, oh yeah, let's try it with paper first. Oh yeah, let's try it with paper. And then as soon as 100 people get beaten up at the door because they're doing it with paper, then I guess we'll release the digital version. No, they should just come out and release it. Absolutely, it should be digital.
So Greg, with the letter comment, then do you have a template you can send us all? We can then add our names to and sign it and send it on.
We can certainly do that. We can get something out to you.
Thanks.
That's not a bad idea.
Yeah.
Who's on from Greater KW? Is anybody on from Greater KW Chamber here? Don't be shy. You can speak up.
What were you looking for?
I'm just looking for somebody, if they can maybe get a message to.
Yeah, sorry, it's Carolyn from the
Hi,
Greater
Carolyn.
KW.
Can you maybe that particular information about a template, a letter that we can distribute? It might be a good idea if both of us sent out to our members and said, you can, sign this letter and we'll have it, addressed to local MPPs as well as the premier. And maybe we can get Art to help us formulate that letter as well.
Absolutely. I'll connect with him today on that.
Thank you, Carolyn.
And send us the email addresses where we should send it, if you don't mind to, please.
Oh, yeah. Email address to where it goes. Yep, for sure.
Yep.
Yeah, that's a really good idea. I think we can inundate them with letters, and that would be a really good thing for us to do.
Agreed.
I know. And then they'll hear from other people in the region rather than Ian and I, which will be kind of nice too, because I think they get sick of us. But I know the premier does, because he never shows up for any of our meetings. So Cheryl, that's a really good question. They should. It should be credit card size wallets or cards for wallets. But I think what they're going to do is they're going to bring out the digital version. And then what they'll do is they'll probably, for those people who don't have a phone that you can download the digital version, I think they're going to have to provide cards. I believe that Manitoba did cards. And it seems to be effective. And my understanding is the card just has a QR code on it, and it works exactly the same way. So yeah, good. Have you seen it? Have you used it, Cheryl? Have you? Very good. Very, very good. Well, it's 3:02. Is there any other question? Oh, Staples and UPS laminate. Yeah. Is that right, Julie? Staples and UPS will laminate your existing vaccination receipt? Do they, wonder if they reduce it? Because this, I would hate to carry around a laminated version of this. Like that. Even
Yeah,
if I did this.
You're no longer carrying a wallet, you're carrying a backpack.
Well, yeah, like there, that's like carrying around an iPad with me all the time. You know, I'm not going to do that, for crying out loud. Oh, is that your little receipt? Yeah, that's what you got at your last vaccination, and then you laminated that. That's a good idea too. I think I maybe have mine in my wallet. That would be a good idea as well. But as Brian said, alluded to, number 18 on this Q&A form, it said all versions. So, you know, whatever you can do. And I think lamination is not going to be an issue as long as it doesn't look doctored. That's all. So go to chambercheck.ca and order your screening kits if you need them. We get a lot more people are starting to do. You should, you know, I'm fully vaccinated. All my staff are fully vaccinated, and we still use rapid screening kits all the time. It will not, there's Donna holding them up. She's distributing them. It will not show a positive result just because you've been vaccinated. It doesn't really look for that stuff. So get your kits, and even if you want to just do unvaccinated people, that's fine. That's your choice. But you know, we recommend a couple of times a week doing you can get it. So the last conversation that I had with an expert in this field was, if you're vaccinated, the chances of you getting, you know, a whole lot of virus load is pretty low if you're fully vaccinated. However, you still can get some virus in you, and you still can pass it on. You know, but you don't pass it on in the volumes, and that's why they say vaccinated people, even though they can still get and carry the virus, maybe not show symptoms, they can still pass it, but it's a lot less transmissible from a fully vaccinated person than it is from an unvaccinated person. So, you know, it's always nice to know if somebody's, you know, screening and they're fully vaxxed and they say, geez, I tested positive. You know, that is good information, because there may be unvaccinated people. And that's the last thing we want happen. We had 900 cases in Ontario today. That's going to grow. Alberta, as you know, has about 160 some or 174 ICU beds, and they got about 259 people in ICU. Today, their health system is collapsing on them out there because of protocols. And so we just have to be a little bit diligent. We can get through this easy as more people get vaccinated, and if we continue to screen those who resist, and even those of us who got fully vaxxed. So folks, hopefully this will help us through. None of us want this. I just want you to be clear. While the chambers have supported vaccine verification, we did not want this. This was the last thing that we wanted, but except there's one thing that's further down the list. We don't want another lockdown. And the only path between here and staying right here and not locking down is vaccine verification. And we just want to work with government. We've told them we'll help them, but listen to us, because we're listening to our business members, and we know what they need, and they need a lot of support, as you heard from Vanessa and others. So Thanks very much, folks, for joining us today. Thanks to the Greater Kitchener-Waterloo Chamber of Commerce as well for their help with this. And we're here to help you. So give us a call or email at any time. We're here to help you wade through the murky waters of COVID-19. Have a great weekend, folks.